Okay, so officially welcome to our July webinar. This evening we will talk about how to take care of your skin. When you selected this topic last month, I asked you to send me questions and requests, and in general, what you'd like to hear uh, regarding this topic. So what you're going to hear tonight is what you've asked me to prepare, and I think I've more or less managed to encompass everything that you've asked for. And if there's something else that you'd like to know, you can email me or write a message here, and then we can have another webinar on skincare. I'm perfectly open to the idea. If I don't know how to answer some of the questions, I will happily consult a dermatologist for you, because it is important that you have good and reliable information. So before we begin, please make sure you vote to select the topic for next month. And if you have any topics that you would like me to address, but they're not included in the poll, let me know, and then I will put them so you can vote on those next month. So here are some of the topics that we will be talking about tonight. We'll talk about skin structure. What is it that our skin is made of, and what is it that each part of the skin actually does. Um, so that would be one. We'll talk about normal skin functions in terms of what is it your skin does for you and why is it so important. We'll talk about the notion of the perfect skin and having completely smooth skin. I will only briefly address this, even though several of you asked me, and then the more I kept thinking about it, the more it seemed like a topic for a whole webinar. So I will put it in the poll for next time, and then maybe we can have a webinar on the subject. We'll talk about KP, or keratosis pilaris, because this is a frequent trigger and a rather common condition. This was quite requested. We'll talk about itchy skin, what can cause it and what you can do to make it less itchy. And then we'll talk about first aid and what is it that you can do immediately after picking to make sure that you protect your skin as best as possible. So this is the I think the best way that I was able to structure your questions and requests. Again, if you think of anything else that you would like me to address in the future, we can have more webinars on this topic. I know that this only scratches the surface. So even if you think of some questions that I don't, about topics that I don't mention, you can ask them in the Q&A, or even better, email them to me. This evening will go for as long as I can, because I cough quite a lot. And my apologies, now that I said, I cough, I had to cough. So if I don't feel well, then instead of the Q&A, we'll have one next week with the shorter webinar. And I also set aside some time on Thursday so that you can email me all the questions that you have, and then I will answer them in writing. Because even though I don't feel quite well, I don't want to leave you without the Q&A part. So let's get started. The way I structured this just seemed as a logical progression. So first we will learn about what the skin looks like and what it's composed of, and then we'll move on to what it does and what can possibly go wrong. Like, that's the overall idea behind this webinar. As you can see here, the skin has, I hope you can see my pointer. The skin has three main layers, or three main components. The epidermis, meaning the most superficial layer of the skin. Epi is a Greek prefix that means on top of something. So it's the when you look at your skin right now, what you see is just the most superficial layer of the epidermis, right? Under the epidermis, you have a layer called dermis. And then there's a layer of fatty tissue that has nerve endings and blood vessels in it. So when you pick your skin, essentially what you do is that you injure or alter somehow the first layer or the second, or the first and the second layer. So either just epidermis or both epidermis and dermis. And I'm going to explain to you what they're composed of and what is it that they do. As you can see, there's quite a lot of stuff that exists in our skin. Um, Epidermis is basically composed of cells that grow upward. So there's a thin white line here that separates epidermis from dermis. If you take a look at the picture, uh, on this line, it's called the basement. Whoops, sorry, it's called the basement membrane. And on this line, you have a thin layer of cells that reproduce, and as they reproduce, they kind of move upwards, creating all the other layers of the epidermis. As they go towards the surface of the skin, these cells become more tightly packed and they become more mature. Once they reach the surface, this is where their life cycle starts to end, and then they slowly fall away. This is something that happens to individual cells, so it's not necessarily something that we can see with our naked eye. This shiny layer here is called stratum lucidum. So these layers have their names, but I really don't think I need to bother you with that. This is just an interesting tidbit, which is that this layer here doesn't exist everywhere. It exists in only two parts of your skin. It exists on the soles of your feet, and it exists on the palms of your hand. This is an extra firm layer of cells that gives these parts their strength, and also makes them more resistant to heat, for example, and pain. This is because we use these all the time, so they need an additional layer of protection. Uh, the basement membrane serves one simple purpose, which is to separate the epidermis from the dermis. In the dermis, as you can see, there's a bunch of stuff existing and going on. First, you have the sweat glands. The sweat glands go all the way to the surface, and they're connected to the blood vessels or to the capillaries. They have a purpose in regulating your body temperature. Essentially, what they do is they take water and electrolytes and excrete them on the surface of your skin. As this liquid, which is basically really just salt and water, as it evaporates, the heat evaporates with it. So your skin actually allows you to have well-regulated temperature. This is an incredibly important function of the skin. You also have nerve endings, and at the end of each of these, you have a different type of a body. Some are called the Meissner bodies, some are called the Pacini bodies. I don't want to get into details, but what's important to know is that these nerve endings help you with sensation. So this is thanks to these nerve endings, you can feel things, including stuff like pain, but also vibration and subtle touch. You have blood vessels, because they're needed to kind of feed these structures. You even have muscles within this upper layer of your skin. And this muscle has one job to do, which is when it contracts, it makes the hair on your skin stand out. It's a very, very small muscle, but it's there. And as we've all witnessed, it works quite well. You have the hair follicles. They're also in the lower parts of dermis. And each hair follicle is fed at its root by a blood vessel. Right next to the hair follicles, you have sebaceous glands. They have, whereas sweat glands basically excrete salt and water, to simplify things, sebaceous glands have a kind of more, have a denser substance that they create that has a lot of lipids in it. And it's excreted all around the hair follicles. It actually does several very important things. One, it protects the surface of the skin from excessive humidity and water, but it also has antibacterial and anti-inflammatory properties. So sebaceous glands that people often try to squeeze out actually protect your skin from infections and bacteria. This area between these structures, this kind of light, I don't even know what color this would be, brownish color, I guess. This is actually filled out by two types of fibers. One is collagen, and then the second type of fibers that you have there are elastin fibers. Collagen makes the skin strong, and elastin fibers make the skin flexible. So it's thanks to this part that your skin is able to bend and stretch and then narrow down. Once we age, this area undergoes a little bit of change, and then our skin becomes a little less elastic. But it's this layer of skin that keeps your skin tight and elastic, right? And then underneath all this, you have a layer of fatty tissue, and then nerve endings and slightly larger blood vessels. All this fits into a very thin layer of, of the skin. So as you can see, in something that looks very simple, there are a lot of things that have to work at the same time and a lot of things that can go wrong. So for example, when you pick your skin, certainly you damage the epithelial epidermis, so the epithelial tissue, this part on top. And every time when there's blood, that means that you've reached under this surface and that you've injured some of the blood vessels here. That means that you could also touch on these muscles. You can also alter the root of the hair, or sometimes kind of block the canal through which the hairs grow, which then makes the hairs grow in. What you certainly do every time when you pick your skin is that you breach this membrane and introduce bacteria deeper into the tissue, therefore always risking an infection. Because remember, sebaceous glands produce that oily substance, but that oily substance actually helps kill a little bit of the bacteria that live on the surface of your skin, so it's protective. So this is just a brief overview of the skin anatomy. There's a lot more to be said, but because this is not medical school, I don't think we need any more details. Let me just briefly list what some of the main functions of the skin are. Keep in mind that this is not an extensive list. So your skin does more than this, but these are some of the most important things. And you'll see why we talk about the skin as not only being the biggest organ in the body, but also a vital organ. So first of all, I think maybe the most obvious of all, skin is a protective barrier against mechanical, thermal, and physical injuries. So basically, your skin protects the rest of your body. It protects it from heat and it protects it from injury. It reduces the harmful effects of UV radiation, which is quite literally a vital thing that our lives depend on. Otherwise, the incidence of cancers, for example, would be much greater. Skin acts as a sensory organ. As I mentioned, if we go back here and look at these nerve endings, each of these separate endings here have a particular ending that is responsible for a specific type of sensation. So you have specific little organs within the skin that can sense vibration, specific little organs within the skin that can sense pressure, and so on. So as an organ, skin is actually a very complex organ, and it contains these little organs inside. It regulates temperature, and this is, again, a vital function. Something that most of us would consider a nuisance, which is sweating, is actually a way for our bodies to continue to function normally. Without regulating temperature, we simply cannot live. Skin also acts as a part of the immune system. This is something that not many people know, but it is absolutely true, and there's quite a lot of research done. If we go back again to this image here, in this upper area called the epidermis, this is where you have these strange little cells called the Langerhans cells, and these cells are a part of the immune system. What they do is they recognize part antigens, so parts of bacteria or anything that's not supposed to be inside your skin. They take it inside themselves, they kind of internalize that part, and then present it to something called T helper cells. And when they do that, they actually activate your immune system. When you destroy this part of the skin, you're actually impeding its immune function. So your skin is an integral part of your immune system. And furthermore, skin participates in our metabolism, including something that seems very far removed, but that is our bones. Along in coordination, very complex coordination with the kidneys, our skin produces vitamin D once it's exposed to the sun. So we need about 20 minutes of sun, if I remember correctly, for the skin to produce all the vitamin D that you need. So as you can see, a lot of a lot of the very important stuff that our body does, it does it thanks to the skin. So in my opinion, it is one of the organs that we really must be grateful for because of all the things that it does. Our lives quite literally would not be possible without our skin. Now, the question is, when people talk about the skin, they very rarely talk about these things that I just listed. When we talk about the skin in therapy, individual or group therapy, doesn't matter. We usually talk about the way that the skin looks. We rarely say, "Oh, my skin really did a good job, activating my immune system today," or we rarely say, "I was so very well regulated thermically today." Instead, we talk about bumps and we talk about scars and scabs and redness or swelling or you name it. So we mainly focus on the aesthetic part of the skin. And we talk about whether or not our skin is smooth instead of whether or not it actually does its job. So just by applying these aesthetic criteria to the skin, we're completely missing the point of why our skin is there. It's kind of like saying, I have an ugly kidney. No one really cares. What's important about kidney is that it works, right? But not when it comes to skin. In fact, we're willing to disregard everything that I just mentioned just to have the perfect skin. Here's something that I found on the website of the British NHS. It's, I think, a very revealing piece of information. So here's what it says. Skin diseases affect 20 to 33% of the UK population at any one time. And surveys suggest around 54% of the UK population will experience a skin condition in a given year. This information was last reviewed last year, so it's still valid and current. That means that in the UK, and it's likely generalizable, up to 1/3 of the people you meet, so every third person that you meet, has some kind of a skin condition. And more than half of the people, so 54% of the people, will experience a skin condition in a given year. When people talk, especially people who struggle with skin picking, when they talk about other people's skin, they usually make, I'm sure this is relatable to most of you, very unfavorable comparisons. So and so has such smooth skin, or so and so has great complexion, or so and so doesn't have these scars or these discolorations. Whereas the statistics actually say something different. Every other person likely had a skin issue in the past year. It obviously, they can have different conditions and different degrees of seriousness, but over half of the people will experience some kind of malfunction of the skin. And I think this is not actually that big of a number as it seems, given how much our skin has to do and how many complex functions it has to perform and how much mechanical stress it has to put up with. Especially if you live in an urban environment, your skin has to work overtime to keep itself clean and functioning because it's constantly being buried under layers of pollution that it has to face. So in that sense, no one actually has perfect skin. Perfect skin maybe lives in Photoshop or Instagram or Facebook or wherever you don't see actual living human beings. And even the person that you think has a perfect skin luckily just has a visible part of their skin that is healthy and doesn't have any problems. Uh, or their skin is maybe without flaws at this given moment in time, but that could change tomorrow. So there is no such thing as perfect skin in real life. In fact, the very idea of perfection in terms of perfect skin and the idea of your skin being beautiful is not something that our bodies know about. Uh, it, I guess one way of putting it is that nature doesn't know perfection, or beauty for that matter. Nature isn't interested in our skin being beautiful because that concept simply isn't intrinsic to it. Our skin either works or it doesn't work. That's that's what that's what's important. The idea that skin can be beautiful is something that comes from our culture, it comes from our families, it comes from our own lived experience, from comparing ourselves to others, for example. And what constitutes beautiful skin is also quite debatable, especially if you go around different cultures and then look at what people would consider the ideal skin. Sometimes it has to do with their history. For example, in some countries, white skin is considered beautiful, but not because there's something beautiful about white skin, but because they have a history of colonialism where being rich was associated with being more attractive. And that just happened to have been white people. So the idea of beauty comes from maybe socioeconomic conditions or political conditions. So beauty is a very complicated thing. I have two, I put two pictures here. To me, both represent beauty only in different ways. You might think just one of the two is beautiful. Someone might think that neither of these two is beautiful. And there is no such thing as a universal criterion based on which we can decide. So if you think about your skin in terms of beauty, in terms of smoothness, in terms of perfection, just keep in mind that your body doesn't care about any of that. And that regardless of what kinds of ideas you project onto your skin, the only thing that matters biologically speaking is whether or not it does its job. And if you're listening to this, more likely than not, overall it does its job well enough. Now, let's address KP as something that's quite common and something that is frequently a trigger for many people. This is what KP actually looks like. Uh, the case on the right is, I guess we can say, slightly more severe or just on a different light. So there are tiny little bumps that appear on the surface of the skin, and sometimes these bumps can be a little redder. If the skin is darker, then the bumps will be whatever the color of the skin is, and instead of redness, you might see a more purple. You might see a more purple color instead of this kind of redness. So let's go through some basic facts about KP. First of all, what you need to know is that medically speaking, it's harmless, completely harmless. In fact, there are quite a few dermatologists out there who don't even think of KP as a skin condition. In fact, they think of it as a variant of normal skin. So some of them will tell you that there's nothing to be done if you go and seek treatment because you don't actually have a skin problem, according to them, right? It's often associated with dry and rough skin, and KP is more likely to be itchy than other skin surfaces. It's most often the same color as your skin, but as I said, it can be red or brownish a little bit. This is not necessarily a sign of inflammation. So it's not a sign that there's something happening underneath. It tends to have seasonal cycles. That means that it improves in the summer and it worsens in the winter. So if you have KP, it's most likely now it's less visible or less severe than it will be in the winter. This is something that I don't particularly find it very useful as a piece of information, other than to know when to be more careful. So if you're going to use stimulus control techniques, then you know that it's the colder months of the year when you need to be more attentive and make sure that you use them regularly. There are some things that you can do to take care of KP. So before we get to the treatment, let me just add a few more things. We don't know exactly why people have KP. We've observed that it runs in families, but we can't quite say that it's genetic just because it runs in the family. Uh, One of the reasons why we can't say that is because, well, for one, everyone in the same family is likely to be exposed to similar environmental conditions as well. So if it's caused by, I don't know, specific dryness or humidity of the air or temperature, the whole family is more likely to have it. So in that sense, we don't know if there's any genetic basis to KP, but we do know that if you have it, then it's more likely that one of your parents or siblings or grandparents will also have it. What we also know is that it's spontaneous. It's not only that it cycles depending on the months of the year, but it also disappears spontaneously for most people around in their 30s by the end of the decade, most frequently. It's caused by a rather simple mechanism, which is that keratin builds up and then blocks your hair follicles. So I'm going to show you right here how that's actually formed. So this is your normal hair follicle. And then if you remember, I said that in the epidermis, the cells start growing from these lower layers and then move upwards. And then once they get to the top, they die and peel off, right? And sometimes what happens is that instead of falling off, they stay here and then close off this entrance here. So the hair cannot grow out. And then as it starts to grow out, it creates a bit of a bump on the surface as it's penetrating the dead cells that are blocking its way. Sometimes sebaceous glands can continue to produce sebum, and then it can also accumulate and make the bump a little bit bigger. Uh, Remember, just having sebum here is not a dangerous thing or a bad thing at all. It has anti-inflammatory properties. So even though the bump might be visible, you're still safe from any infection. Even if there's redness, it's because you have blood vessels underneath, and then because they're full of blood, you can see the redness from the surface of the skin. It still doesn't mean that anything's infected. If nothing's infected, it means that it doesn't require any kind of intervention. Again, when you try to remove the layer of keratin right here, you have to press here on the edges of the hair follicle. And then as you do that, you're not only penetrating through the epidermis with your nails, for example, if you don't use any tools, you're also moving and then possibly cutting off the circulation to the skin follicle, and you're also risking damaging the sebaceous gland here. Once this happens, you're actually even, and also not to mention that you're introducing bacteria from the surface. But even if the bacteria don't cause an infection, you're still very, very likely to trigger an inflammatory response. And here's why. Our immune system doesn't just attack bacteria or viruses or, any kind of foreign infectious agent. Once you start causing damage to the structures within the skin, once you have cells that rupture the structure of the tissue that's being disturbed, this debris from the dead cells and the collagen that's being created has to be cleaned up. And this is something that parts of our immune system do as well. So even if you don't introduce bacteria, you're very likely, by just trying to squeeze out the keratin, you're very likely going to cause an inflammation in the lower parts here, because the damage that you do has to be cleaned up somehow. And that, of course, can create a scab, and then you enter into the well-known vicious cycle. So what can you do about KP? Think about KP as something that you deal with chronically, not something that you can simply remove. It's not a wart that you can just, cut off and then not have anymore, or a mole that you can have surgically removed. So what you need is a specific skincare routine that will minimize KP, even if it doesn't eliminate it entirely. So first of all, because KP is associated with dry skin, in fact, when the skin is not moist, when it's dry, that helps keratin stay stuck to the skin instead of falling off. So you need to make sure that your skin is moisturized. But when you use products, there's really no need to spend obscene amounts of money on expensive products made from, I don't know, like the placenta of a specially cultivated kangaroo that lives in one region of Australia or whatever. Because a lot of these creams are advertised and sold at really very high prices, and they don't do anything better than cheap creams. And in fact, because of the scents and the chemicals used in them, they can actually make things worse. So find mild and unperfumed soaps and bathing products. So smell is your enemy. Fanciness is your enemy here. So something very, very, very simple. And then when you wash your skin, what you actually need to do is just gently scrub it with a washcloth of some sorts. And don't take very hot baths. First of all, a hot bath is very likely to trigger you because it will make the bumps more visible. Remember, when you find yourself in hot environments, those blood vessels that you have in your skin, actually we can show them here. So these blood vessels here, the capillaries, and then also the blood vessels beneath them, will expand and open up. And when they expand, that means that more liquid is going to come out of them. And it's going to cause a slight swelling of the skin, which is going to be most visible here in the bump because the bump is already very dry. So it contains dead cells, and then they're going to inflate. So the bump is going to look much bigger. And when these capillaries here are expanded and open, they're also more visible. So it's going to appear red. If you take very hot showers and then look at yourself in the mirror right after, it is more likely that it's more likely going to be triggering than not, precisely because of this. There's actually nothing has changed, nothing is different, your skin is not in any kind of trouble, but it looks visibly different and it causes problems. So when you have KP, what's recommended is that you take cool or lukewarm showers and baths. So try to avoid extremely hot water. Or if you can't avoid it, then by all means try to avoid the mirror afterwards. There is a number of creams that you can get over the counter, so you don't need to consult a doctor to get them. You can just visit CVS or Walgreens. I think CVS is like one of my favorite places on earth. Like I could just spend days trying different supplements. So my recommendation is CVS. What you need to look for are creams containing lactic acid or salicylic acid, even better, or urea. Because what they do is they help loosen the connection between those skin cells on the surface. And that means that the dead cells that need to fall off are more likely and more easy, they fall off more easily. So by applying salicylic acid or urea creams, you will allow your skin to naturally get rid of the dead cells. And the bumps will eventually become smaller and go away because all of the accumulated and stuck cells will glue off and peel off and fall off in the end. Another thing that you can do is to use creams that are derived from vitamin A, like they're known as topical retinoids. They will prevent the creation of plugged hair follicles, but they come with a trade-off. Whereas salicylic acid or urea are pretty much harmless, these can cause all kinds of side effects, but what I'm specifically referring to here is that they can create dry and itchy skin. And if your skin is dry, it'll be redder, and if it's itchy, it'll be an additional temptation to pick. So I wouldn't use that as a first line of treatment at all. I would focus on salicylic acid and urea. And both of these, I'm 100% certain you can get at any pharmacy, really. And they're usually over the counter. Before you try them out, so this is a general rule that I think at least the female portion of the audience will know. As a general rule, don't apply it to the entire area where you have KP. First, try it out on a small area, just like one small corner the size of your pinky nail or something, and just to see how your skin reacts. Usually, I don't know that anyone has ever been allergic to salicylic acid or urea, especially to urea, because we already have it in our bodies, but you always have to be sure because we never know what other products they might add. So first apply it once or twice to a small area of your skin, and then see if there's any swelling or redness or pain or itching. And if there isn't, then you can apply it and use it regularly. So this is the best way that you can take care of KP. It takes a while, so it's not an overnight solution, and you have to be more diligent with this kind of routine in the colder months of the year. But this is what works, and this is according again to NHS, because I quite like their website and I usually check my references there, and also according to a dermatologist friend of mine. So here are some things to avoid. So avoid at all costs using perfumed soaps or any kind of bathing product that will additionally irritate or dry out your skin. This includes those shower things that have like exfoliate, like I don't even know how you call them, those like exfoliating granules in them. And when you combine those with very harsh scrubs, you can actually make KP worse by causing additional damage to your skin. So even though there are things that need to be removed from the surface of your skin, using any kind of harsh scrub is not going to get you there. So it has to be done slowly and very, very gently. So again, as I said, avoid hot baths or showers. And whatever you do, avoid scratching or rubbing your skin. Because KP is associated with dry skin, if you scratch it, it'll be even more intense, or if you rub it as well. So those are things to avoid. Now we're going to go on and talk a little bit about itchy skin, or as the fancy name says, pruritus. Somehow medical terms make everything sound so dangerous, like I have pruritus, whereas I just have itchy skin. So there's no formal definition for this. It's just an unpleasant sensation that leads you to scratch your skin. The most common cause of itchy skin is just dry skin. This is something that many people struggle with, but it is most common in elderly people, because as we get older, our metabolism changes and our skin quality changes, so it becomes drier, and then it tends to be itchier. So that's why it's more pronounced and more common in elderly people. This is something that also kind of coincides with my clinical experience, is that I think maybe the most common trigger that my older clients, and I mean 16 and over, will say is that they're triggered by having extremely itchy skin. The most frequent areas where skin will itch are scalp, arms, and legs. Along with the itchiness, you can also notice that your skin can be red. Obviously, if you pick or scratch, you will have scratch marks or scars. You can have a lot of bumps on itchy skin too, and that's not a sign of a dermatological condition. It's just something that goes along with itchy skins. It can also be unequally colored. It can also be cracked and have scaly patches, all of which do not need to be removed. So I cannot emphasize that enough. Be aware that once you start scratching the skin that itches, you get into this kind of itch scratch cycle, because the more you scratch, the more it itches. So the best way to prevent this from escalating is to avoid starting to scratch to begin with, which I know is not as easy as it may sound. Now, for most people, I said that that skin itching can be localized and it can be generalized. Typically, if it's generalized, it might require you to pay a visit to your doctor. I'm going to go over some causes other than dry skin, just so that you can kind of assess maybe some of that may fit your situation. Because there's something specific, it's the last one here on the list, psychiatric conditions, and I want to address this, but in order to talk about itch as being psychogenic, so something psychological, we really have to exclude all the other things that it can be. Because obviously, before we jump to the conclusion that something is psychological, we want to eliminate any somatic conditions that may cause it. So this is not a complete list. This is just a list of maybe the most common causes. So there's cirrhosis, which is just a fancy way of saying, again, dry skin. It can be caused by psoriasis. Psoriasis is characterized by those kind of circular or oval patches of scaly red skin. It's a condition that definitely has to be treated by a dermatologist. Psoriasis is an autoimmune condition and really requires serious treatment. Scabies, I just missed out on an I here because for whatever reason that letter is malfunctioning on my keyboard. Burns can cause itchy skins. Scars can cause itchy skins. Hives as well. The reason why scars and hives cause your skin to itch, again, is not because there's anything fundamentally wrong. If you remember how what the structure of the skin is like, once you pick your skin or once your skin is damaged in any way, or when hives are created, what happens is that you have a lot of liquid in the skin, so the skin gets swollen. This puts additional pressure on those nerve endings in case of hives, and that irritates the nerve endings and then causes the itch. For scars, it's a slightly more complicated situation. So I'm just going to go back to that picture, the drawing of the skin, and explain. So when you, let's say if you pick and then you kind of destroy this layer of skin here, or you just cut yourself, so we don't even necessarily have to talk about picking, but anything that will damage the epidermis and the dermis, which is what happens most frequently, as long as you see blood, this is where the capillaries are, the damage is all the way here. If you remember, I mentioned that this brownish color here in the dermis is actually just a lot of collagen. Now, what collagen does, it's not that it's just stuffed in there in between elements. Collagen creates like a network for the skin. And then once the skin starts to heal, collagen has to regenerate first. And then other elements of the skin can grow. And as collagen synthesis is taking place, and as it's kind of reforming this network that epidermis is going to grow on and heal on, it irritates these nerve endings here. And when they're irritated, this is when we feel the itch. So this is whenever you pick and then your scars start to grow back and your skin starts to recover, the healing process itself can cause the itch. Whatever you do, obviously, scratching the itch is not the solution because you're risking, causing even more damage to your skin. And again, obviously, this is something that we want to avoid. We have allergic reactions, and any kind of skin irritation will cause the itch. Some neurological disorders like multiple sclerosis can cause the itch as well, although this is not the most common symptom of MS, but it can be. And then chronic conditions like liver or kidney disease, anemia or diabetes or thyroid problems can also cause your skin to be very itchy. And in these cases, the itch is usually all over your skin. So it doesn't choose just one region, it's everywhere. Which is why I said if you have generalized itch or if your skin itches for a long period of time, let's say a month or more, this is really a good time to have your doctor take a look at it. It can be a GP or a dermatologist. So these are the physical conditions that can get your skin to itch. But there are also psychological conditions that can get your skin to be very itchy. Here I listed 3: anxiety, OCD, and depression. Anxiety is by far the most common and most important one. Very, very frequently, in absence of any skin condition, tension and anxiety and even stress can manifest themselves primarily as itchy skin. And then especially in the area of your scalp. And then once you start scratching the itch, you will start removing layers of skin, and then it'll seem like you have dandruff, for example. And you might mistaken what is actually stress with dandruff. And then I see a lot of you are raising your hands. Just please just type the question, and then if I can't answer all your questions, you can email me. I put my email on the last slide. So sometimes anxiety itself can be the cause of pruritus. When this happens, the solution is obviously also psychological. So dealing with anxiety then will be a way to deal with the itchy skin. So this is one of those cycles that skin picking can very easily create. If your tension and anxiety manifest as itchy skin, you start scratching that. It creates scabs, bumps, irregularities, more itching. Then you come back to that place, then you create a wound, and then it goes on and on. And at the same time, this amplifies the anxiety in the background as well, which is why, as always, we have to take a step back or a few steps back and then address what the underlying issue is. In this case, that can be anxiety. But as I said, I don't think it's wise to just immediately jump and say, well, you're itchy because you're anxious, even though I see that daily with my clients. First, I usually ask them, if they have any skin changes or if they have any skin conditions. And then once we eliminate this, then we can talk about anxiety as being the cause of the itch. What can you do? Let's start with self-care as always, because my idea is to give you some useful advice that you can use yourself without having to see a doctor, obviously. So first, you have to use skin creams or lotions that moisturize the skin. And what you need to do is use them after a bath while your skin is still damp. So don't wait to apply them when your skin is dry. Just while it's still damp, that's when you apply them. This will allow your skin to absorb even more moisture, and this will alleviate some of the itch. If you're outside, always wear sunscreen. Being exposed to the sun can make the itch even worse. Use gentle, mild soaps, as I mentioned for KP. This also works for skin itch as well. And then also shampoos that are mild, and shampoos that have zinc in them or mint, because they have anti-inflammatory properties. So just in case your skin is slightly irritated, these might help alleviate the irritation and then also alleviate the itch. Most of you already know this without maybe knowing that you know this, but think about Head and Shoulders, the shampoo. It contains zinc, and what it does, it removes dandruff by kind of by calming down the irritation and then helping your skin regenerate. So that's one very available and affordable source that can help you deal with itchy skin. Again, avoid hot showers. Hot showers, as wonderful as they may feel while we do them, they irritate the skin, and then they're going to make the itch even worse. You can also put ice or some kind of basically anything cool over the itchy area, and this will reduce the itch. Although I have to say this is just a temporary solution, so it's something that you can do, but you will have to do it repeatedly, or maybe do it just when the itch is intense. And then pay attention to the kinds of clothes you wear. Avoid anything that might irritate the skin, such as wool or synthetic products. You can use cooling gels. You have a lot of these like after sun creams that basically cool your skin down, and these are very good for the itch as well. And then you can visit my favorite store in the world, this CVS, or I guess Walgreens is fine too, and take some of their OTC, over-the-counter anti-itch creams. So there are preparations that are already available there. This is all providing that you don't actually have a skin condition underlying this, because if there is psoriasis, skin itch as well, but then you need to address psoriasis, because an over-the-counter cream is absolutely not going to be helpful. If what causes your skin to itch is anxiety, these might help, but ultimately, again, they're not the solution. In that case, the solution is to actually deal with anxiety. If this is persistent and if it causes you serious concern, you can see a doctor, and there are several things that they can prescribe. Sometimes they will prescribe SSRIs such as fluoxetine or sertraline. That's Prozac and Zoloft, basically. Although once you start taking them, exactly the same as for anxiety or depression. You have to wait quite a while for them to work. And when it comes to itchy skin, sometimes I've seen numbers even up to 9 or 10 weeks. So it takes quite a while for them to start working. Corticosteroid creams can be quite useful, but they're usually used in short periods of time. When corticosteroids are applied all the time to your skin, they can cause some quite serious consequences, including skin atrophy, which is something that you obviously want to avoid. So if your doctor prescribes you a corticosteroid cream, it's likely going to be for a short period of time just to alleviate a strong itch. I believe you have some of them available over the counter as well, but please keep in mind that, first of all, they have to be used carefully, short periods of time, and if you have any kind of skin inflammation, stay away from them. Corticosteroids will suppress your immune response in that area where you put them, and that's the exact opposite of what should be done if your skin is inflamed. Sometimes there are creams that combine corticosteroids and antibiotics. That would be a good choice, or better choice rather, for inflamed skin. Your doctor can also prescribe calcineurin inhibitors, which are basically immunosuppressant drugs. So this is not something that I think we should take that seriously, because this is not a drug that a doctor will prescribe lightly or easily. They can prescribe topical anesthetics, although only in specific areas of your body. So you have to use them in limited areas, and make sure that you don't use them near your eyes, for example, or mouth, or any of the gentler tissue. Capsaicin can help, and phototherapy can also be helpful. Although for most people, these will not necessarily be something that you have to use. The final topic that we have for this evening, this is first aid. So what to do after you pick, with a slight note, which is what is it that you should do before you pick as well. If your picking is focused, then do yourself a favor and before you pick, wash your hands. This is obviously, I mean, it's better not to pick, but if you are going to do that and if there's no stopping you, then at least make sure that you don't create any additional complications. Because if you cause an infection, it might lead to scarring afterwards. It's actually more likely that it will. So do whatever you can to do it safely and without causing any unnecessary complications. So obviously the first step is to stop as soon as you possibly can. I guess that's an easy one to understand. Second of all, rinse your skin under the running tap water for at least 30 seconds. Or in case if you do it on your face and you can't, it's difficult to do, wash your face a few times. First, wash your hands in that case, and then wash your hands with running tap water several times, 4 or 5 times at least. Do this, please, even if you don't see any open wounds or blood. The reason why is because you don't need to create a complete sore to put yourself at risk for infection. It's quite sufficient that there's a micro tear in your skin that bacteria can go through and your skin can get infected. So make sure to wash it. Again, don't use hot water. You can use kind of lukewarm water. That would be the best choice. After you do that, so at least 30 seconds under running tap water, use a liquid soap. So something gentle and unscented. This is, I know that this is not like, people like to use cosmetics that smell nice, but they're not necessarily the best choice when it comes to things like this. So medical soap, something very, very gentle that has no smell or color, preferably. Rub it over the wound very, very gently. So you don't want to irritate the wound anymore, but you do want to cover it so that you make sure that you remove any debris that you can remove from the surface, and obviously to remove anything that can cause an infection. And then rinse for a minute. So you will need about 1.5 minutes up to 2 minutes of self-care after you pick. And this goes for, each picking site. If they're all in one area, then this is the time you will need. 2.5 minutes is not very much time considering how long a picking trance can last. So make sure that you do this. And then once So first rinse, then apply a gentle soap, and then rinse for 60 seconds. So 30 seconds and then 60 seconds. And then use an antibiotic ointment. You have a lot of them over the counter, so they're very easy to get and they're usually quite cheap. And then put a thin layer over the skin. If you need to, and I recommend that you do if you can, put a colloid patch over that as well. Because first of all, they're quite firm, so you can't remove them that easily. You can leave them on even for a couple of days. You have the antibiotic there, so you'll prevent any infections. And by covering your skin with something so firm, you will prevent yourself from scratching or touching it again, and then you will allow it to heal. So these would be four, I think, rather simple steps that you can take. There are two reasons why we want to do this. One is obviously that we want to prevent infection. This I cannot underline how important that is. If you've ever had an infection after skin picking, then you know what I mean. They can be quite serious, and bacteria that live on the surface of our skin and that under normal circumstances don't cause any problems can be surprisingly difficult to treat. I've had several clients over the years who've had MRSA infections because of skin picking, and this is a type of staphylococcus that is resistant to most antibiotics. So it's extremely difficult to treat once the infection spreads. And then I've even had a client who became septic as a result of skin picking, two clients actually. So in that sense, this is medically extremely important to wash your hands before and then do these four steps that I outlined here. Three steps rather, if you ignore the first one. The second reason is that simply this is a way for you to start having a healthier relationship with your skin by providing first aid to your skin. And these steps are simple, and 2 minutes is not a lot of time. So don't use that as an excuse to skip this, please, because I usually share this with clients that need it, and then they'll tell me something. Well, I don't have time to wash it, and then I think you have half an hour to pick, but you don't have 2 minutes to make sure that it doesn't cause an infection. It's kind of like when people say, I don't have 20 minutes a day to meditate, but I have 80 minutes a day to spend on Instagram. So please make sure to be diligent about this. This is not a difficult process, and when you repeat it a couple of times, it'll be much easier. So the first reason is the medical reason. The second reason is that it helps you develop a healthier relationship to your skin. What you're actually doing is a kind of compassionate action to your skin, because you're helping your skin heal. You can take some time to observe your skin, to see the damage that was done, and to really kind of be mindful of the effects of what it feels like and what it looks like. So both reasons are good in the long run. If you avoid an infection and help your skin heal faster, obviously you are reducing further triggers. It's a form of stimulus control, because you will have healthy skin, so nothing to pick. And then if you develop a more a kinder approach to your skin, you're more likely to want to hurt your skin in the first place. One way to do that actually is to learn even more about how your skin works. At least for me, I think before I went to medical school, I don't think I cared very much about what my body does. What I would usually do is I would be upset if I'm sick, because then if you can't go out and play with your friends or do what you wanted to do, then you get upset that your body now has the flu or COVID or anything else. But then it was only medical school when I started learning about what my body actually does and how many processes have to take place at the exact same time in a very precise way, highly regulated, that I started appreciating it more. Maybe it's not necessary for everyone, but for me, that knowing how it works really helped appreciate what it has to do to keep me alive. And something as simple as the skin actually does help you keep you alive. Skin is a vital organ. You can't live without it. It has to function normally. It's tied to nearly every important function in your body. So maybe learning even more about how your skin works would be a nice shift, because you would move away from the aesthetic and then move towards the functional. So what your skin actually does very well every day. I've learned to be, when I was younger, when I was in high school, I used to have quite severe acne. And I remember how frustrating that was for me. And later on, I kind of even appreciated those, because that means that my skin is able to defend very, vigorously against anything foreign that gets into it. So it actually does its job a little too well. A little, it was maybe a little overzealous, but it is a process that maybe caused some, anxiety. But at the same time, it has protected my physical health so many times, countless times. So the more you learn about how your skin works and what it does for you, I think that can also help you reframe your relationship to it. At least for me, that was the case. Maybe it's not for everyone, but think about how you reacted to the first part when I explained the structure and the function of the skin. Did it make you, uncomfortable? If so, think about why. If it made you feel, I don't know, more confident in your skin, maybe that's a direction to take. It's definitely, I think, an important topic to explore. So ultimately, in order to have a healthier skin, moving away from the visual, from the aesthetic, is extremely important. Because once again, our biology doesn't care how things look. It only cares whether or not things do what they're supposed to do. And in the case of your skin, most of us actually have skin that is quite functional. Even when we have skin infections, that's a sign that the immune system part of your skin is functioning well. So as weird as that sounds, it's definitely something to be grateful for. The problem is only on the aesthetic level, because people are afraid to be judged or seen in a certain way, or whatever, you name it. But none of that has anything to do with our biology, with what our skin is actually meant to do. So with this, I'm going to bring this webinar to an end. I will try to answer at least a couple of questions before ending it, but then you can also email me your questions. Let me end the poll first so that we can see what the topic is for next month. I'm going to share the results with you in case you're interested. Let me just scroll and see what won. 42, 43. So by one vote, it was a very close call between self-worth, self-compassion, and skin picking, and then how to deal with relapses. And relapses won by one vote. So in August, we will talk about relapses, how to deal with them, and how to prevent them. Obviously, that part is very important. So without further ado, let me just get to some of your questions, because I'm already feeling a little dizzy, so I want to be as efficient as possible. As I said, here's my email. So if you have any technical questions about the program or anything else, you can email our support team. If you have any questions about your skin, you can email me. When it comes to psychological questions, our support team can also help, because a psychologist will respond to your email. But when it comes to the medical stuff, I might be a better address. As I said, I left some time aside on Thursday, so I will answer all of your emails on Thursday. So please freely email me. Let me just get to whoops. Okay, apparently I stopped sharing my window. Let me just get to some of your questions here. Will we be covering how to care for our skin after picking? Yes, in fact, we have covered that one. I don't know what to think. I don't know what to think. It's at the same time comforting and also triggering to think about all the things that are inside my skin, because I don't know if I'm supposed to appreciate them or if I'm supposed to remove them. So I can understand that you feel conflicted, because that image of the skin really shows a very busy organ. But ultimately, the reason why I showed you this is how something that is so simple and so easily judged, based on aesthetic criteria, actually does so many things and contains so many parts that have to work in unison in some way. So for me, that's a way to appreciate it more. I'm wondering what your thoughts are on Manuka honey. The hydrocolloid antibacterial healing benefits sound promising, but it is very expensive and I feel vulnerable to scams that promise such skincare benefits. It sounds like a good option because dressing can be used on broken skin and left for up to 5 days without removing and reapplying, which is a triggering process, and the barrier is helpful. Also, medications that contain antibiotics and steroids can only be used in moderation and for short durations. Yes, you're absolutely right about this, and I mentioned that part as well. That if whatever you use for your skin contains corticosteroids, then you really have to be careful about how frequently you use it. As far as Manuka honey goes, well, it's been tested all over the place and for all kinds of stuff. I've seen it tested for its anti-inflammatory properties, um, in human medicine, by dentists, even for animals, for all kinds of stuff. It seems to have a mild to moderate effect. For skin picking specifically, I haven't seen any studies, but like, just because it is so expensive, I don't think I would recommend it. Because I don't think it's worth the price because you have much simpler ways. If you want to help your skin heal faster, you can use something as simple as, supplementing with vitamin C, for example. Vitamin C helps collagen synthesis, so that skeleton in the dermis area that I mentioned, that provides structure to your skin and its strength, that will be regenerated faster that way. And you also have other options that don't include this. So if you can afford it, by all means try it, because it does seem to have some antibacterial properties, but not it hasn't been tested for skin picking, so I wouldn't specifically recommend it. I would be interested in hearing about your experiences if you do decide to try it, but I wouldn't recommend it. I don't think anything bad will happen, just I doubt its efficacy because I haven't seen any studies. Um, on self-care screen, would it not help to add drinking more water also? I'm not being facetious, by the way. I guess I'm curious and asking about the relationship between hydration and moisturizing. It will help to drink more water, but only to a certain extent. So I didn't think of listing that, to be honest, because it's much simpler to moisturize your skin from the surface of the skin. So I didn't understand the question as you being facetious. It is a reasonable question. You need good hydration for many other things in your body, not just for your skin. In fact, your skin would kind of come in on the lower end of that list. So I wouldn't expect any huge difference. Uh, so no, I mean you can. It's not going to harm. I just don't. I just don't think it's going to make much of a difference specifically. Um, I use grape water spray, which is relatively inexpensive. It says hydrates, moisturize, and soothes sensitive skin. Anyway, I find it helpful. Well, if it's accessible and it doesn't cost very much, I don't think there's any harm in trying. When it comes to kind of like I said, you have moisturizing creams that are really affordable. You can actually even make your own. If you look there, I'm not recommending something weird, but usually creams have very simple ingredients. Uh, those creams that are actually helpful. So they will have a base made out of, I don't know, some kind of natural wax, and then you add a hydrating agent, which you can usually get on Amazon. I've had clients in the past who would make their own cosmetics, and that seemed to have worked and it was relatively inexpensive. So there are many, many cheap solutions. There's really no reason to pay a lot of money for skincare. And as I said, sometimes the chemicals that expensive products contain might actually irritate your skin even more. Is it safe to use cortisone cream in the armpits? If not, what can I use for itchy underarms? It especially can get triggered when I get sweaty and I'm allergic to antiperspirants. I'm sorry, I can't speak today. So it's safe to use providing that you make sure that the area is clean beforehand and that you didn't just shave because that would leave a lot of small wounds that are open, and then opening places for infections. You can maybe try some natural deodorants that might work well, and there's like a wide variety of them out there, with without alcohol, with all kinds of ingredients. So maybe that's something that you can consider. I wouldn't use cortisone anywhere for long periods of time. You might use it once or twice or for a week, but don't use it longer than that, because uh, cortisone can really cause skin atrophy, and sometimes that's not reversible. So you don't really want to do that to your skin. It's something that you use only on special occasions. I would maybe opt more for natural deodorants. I missed the first 10 or 15 minutes of the meeting. Is there a way for me to view the recording? I'm very interested in learning about the skin structure that was talked about. Yeah, I will have the webinar uploaded tomorrow, and then it should appear in on the SkinPick channel on YouTube, and you will receive an email. I don't know, maybe by the end of the week. I'm not quite sure, but yes, you will be able to see the recording like any other webinar. Uh, I never thought about the skin as actually doing something other than having to look good. I don't know how to make the change from the aesthetic to the function that you advised. Would it help to learn more? I definitely think it would help to learn more about, how, in general, not just how your skin works, but also how your body works. Like I said, for me, at least personally, it was, I don't know, it caused me to feel incredibly grateful for my body and to be much kinder to it when it doesn't work very well, like this week, for example. So that would definitely help if you would learn more about the function. And it's also very interesting that you say that you never considered what your skin does. Maybe this is because I went to medical school, so for me it kind of seems obvious. But it's funny that you would only look at your skin as an object of beauty or not, but not as something that is really necessary for your body functioning. I think that maybe also shows just how societal expectations influence us and just how strong they are. Because it really, I agree, it's not a shift that one makes and just wakes up one day and says, "Oh well, now I'm not going to care about the aesthetics of it." Sometimes the aesthetic aspect may be important. It's just that it's usually when we put this as the primary thing, when your goal is to have smooth skin, or I don't know, specific skin tone, or whatever you decide that you should have, or whatever you were told and taught that is beautiful, you sometimes might simply exceed the limits of what your skin can do. I may want to fly, but I'll just never grow wings no matter what I do. So in that sense, this approach is inherently very frustrating. And beauty standards, especially for women, I think men are almost, they're not completely exempt. Like skin is something that men care about as well, but it's not as nearly as insisted on as it is for women. So I understand that it is a very difficult shift to make, but it might mean that you have to give the middle finger, pardon me, to some societal expectations. I would say the more of that you do, the happier and freer you will be. Because sometimes, for example, some people have sensitive skin. I can even include myself in that category. I already shared that I had acne when I was in high school, and now as I'm getting older and older and older and older, my skin tends to be very dry in the summer and then very oily sorry, very dry in the winter and very oily in the summer, and it's very annoying. But there's nothing that I can do about that. That's just what my skin is like. What I can do is have two different kinds of skincare routines and then make sure to apply them in a timely manner. But that is the limit of how much I can control. And if I focus on how I imagined my skin should look or function, instead of seeing how it actually functions and then building on that, I will just end up frustrated. So in a way it is accepting like the realistic limitations of what your skin can be, because unfortunately skin cannot always cannot always be what we want it to be. And I don't think anyone's skin is. I mean, what people want it to be. I've had clients who were models and who looked so shockingly good, and then they would find this tiny, teeny little part of their body that is less than perfect, and then that would be the only thing they see. And this is frequently what people who struggle with skin picking do. They will find that one thing that they cannot control on their skin, and then fixate on that as a source of unhappiness. So it's more perception than it is a skin problem. Um, Skin discussion is wonderfully covered. What about collagen and collagen powders? Are they useful or hype? I have to say they're more hype than they're actually useful. I also know that people take collagen pills. The thing about that is that collagen gets broken down. Like if you actually ingest it and take a pill, all the collagen that you take will be destroyed by the acid in your stomach. Some of the amino acids will be uh, absorbed in your body and they might be used for collagen synthesis later on, but you can get those by just eating healthy. So I don't think collagen creams do much. Whether or not collagen can be absorbed through skin, this is unclear, but it's also very unlikely that it will stay in the specific area where your skin actually needs it. Because your skin is not just randomly creating collagen in these areas. There's like a whole network of connected collagen tissue there. So in that sense, I don't think they make much of a difference. Um, just a good skincare routine, vitamin supplements, and healthy diet will give you everything you need. I need to learn how I damage my skin when I pick. So I think I covered this a little bit, and I will try to briefly recap that. And then if you feel like I haven't answered enough, please just email me and I will answer any questions in detail. So actually, we can go back to that image. One second. Where is it? Okay, so here it is. Take any part here. Usually, let's say it's around the hair, around the sweat gland, any part of the image that you can see easily. So once you squeeze your skin, you always do it from two sides, right? So you cause at least two tears, if not a circular tear on the surface. You have to break it here, and you have to break it here. Keep in mind that this light layer that I'm showing you here is usually absent on the skin you pick. This is an extremely firm layer. This is why if you try to pick the palms of your hands or the soles of your feet, it's nearly impossible because these cells are really tightly packed. So this is usually absent. And then what you do is you just start breaking the layers. And once you get to so these cells basically are older as they go upward. And then these cells that are younger in the kind of on the, let's say on the previous lower stages of development, they tend to contain more water and more elements like that, so they're much easier to smush and injure. So the deeper you go, the more damage you actually do. And then what you can possibly do once you break this membrane here, certainly you will cause blood because you will damage the capillaries. You can also break the muscle. That this muscle is very small. I think I am not even quite sure if it would be visible on the transection of the skin, but it's there. You will break the muscle that helps your hair move. You might destroy the hair follicle. And what's even worse is that sometimes you might plug these. You can plug the sweat gland or push keratin inside the hair follicle. That means that the hair will grow in and sebaceous liquid will accumulate here, so you can create a cyst. Sometimes this actually happens spontaneously. People have these, they're called dermoid cysts, sorry, when hair grows in and then sebaceous gland becomes bigger because the hair has grown in and the keratin closed the exit. It cannot be drained and then it becomes bigger and it looks like a bump under your skin. This is completely harmless, causes no problem. Sometimes it drains spontaneously, but if you try to pick it, you will definitely cause uh, bigger problems for yourself. So that's basically what you do. And the deeper you go, the bigger damage you make, because um, this tissue here regenerates relatively quickly. So at whatever rate your skin regenerates, can consider that fast. And then the deeper you go, the slower it will be regenerated. You're also risking damaging the nerve endings here. So that would be the shortest way that I can recap. But if there's anything in particular that you're interested in, just please email me and I will respond on Thursday, as I said. Let me take one or two more questions and then we can slowly end the webinar. Um, my skin gets quite red at the slightest scratch, so even if I pick a little, it turns immediately red and needs a lot of time to fade. I found that mint floral water helps with the redness. Do you have any other suggestions for that issue? So yes, anything with mint might help with that. Sometimes creams that contain zinc can also be helpful. They will help your skin heal and they will also have this anti-inflammatory properties. It's also useful to put anything cool on the skin because uh, when you put ice, for example, on the skin, what happens is you constrict the blood vessels inside your skin, and when you constrict the blood vessels, you reduce the swelling, but then you also reduce the amount of blood because the redness that we see comes from the fact that there's a lot of blood under the surface of the skin. Not like free flowing blood from an injury, although that's also possible, but just blood from our blood vessels, from the capillaries most frequently. So if these are closed, the redness will go away. But the redness itself, if it's just redness, isn't very dangerous. It may cause an aesthetic issue for you, but it is not dangerous. You should think about inflammation when you have redness, swelling, and then pain on touch. That's when you should consider an infection. That's the dangerous kind of redness. But if it's just redness on flat skin, you don't actually have to do anything. Mint will definitely help. Zinc will definitely help. Putting ice on it will also definitely be helpful. Sometimes salvia, I believe, is the name of the plant. It also has anti-inflammatory properties and it can be quite helpful. And aloe vera has anti-inflammatory properties, so you can use the gel and put it on your skin. It'll help it heal faster and it will at least take care of the redness a little bit. Um, One last question. Would you advise anything different in the self-care process for those who pull as opposed to pick? So definitely, that depends on the location that you pull from. Unfortunately, you can't, especially if you pull throughout the day, you can't take, showers and wash your hair 3 times a day. I mean, if you can, I really envy your free time. So in that situation, I would suggest something differently. But in general, when you pull your hair, the risk of infection is much lower than when you pick your skin because you don't actually do a lot of damage to the epidermal layer of the skin. And it doesn't break the integrity of the skin. It just removes something through an opening that's already there. But in general, if you pull your hair, and if one thing that just comes to my mind right now, but again, please email me with a more detailed question. This is just randomly what occurred to me is that sometimes when you pull from the same location or at least the same area, what happens is you can irritate the skin and then it can start to itch and it can even show some redness. In that case, over-the-counter creams would be rather helpful. Although it is a little bit difficult to put them on your scalp, for example, in which case you can just get something as simple as Head and Shoulders. Like that shampoo I know is not the greatest form of hair care that you can imagine in this world, but it does have a very strong anti-inflammatory effect, especially the one that has mint or tea tree oil. That can be very soothing and it can reduce the irritation in that area. But otherwise, when it comes to hair pulling, the risk of infection is much lower, so there's less to worry about. With hair pulling, I think hair regrowth is more of an issue. We'll also have a webinar actually tomorrow that talks about hair specifically. So you may want to join that webinar. I can send you the link if you haven't registered for it. I think this would be a good time to stop. There are at least 20 questions that I didn't even touch yet. I really apologize, but my throat hurts at this time, and I feel like I'm going to start coughing again. So thank you all for coming and for sticking around. Next month, I managed to forget without writing down what the topic will be. Horrible. The topic will be how to deal with relapses. So we'll talk about relapse prevention next month. Have a pleasant evening and see you next month.